In this lesson, we will talk about Beyond Checklists, a critical and applied analysis of cultural competence integration in health assessments. Integrating cultural competence into health assessments requires moving beyond static checklists to embrace dynamic, equity-driven frameworks, actionable strategies, and genuine community partnership. This approach not only improves data quality and trust, but also drives more effective, just, and sustainable health outcomes. The table of contents outlines a logical progression through the key aspects of cultural competence in health assessments. It begins with an introduction to the topic and its significance, then traces the theoretical evolution from early competence models to modern equity-centered frameworks. The document details evidence-based strategies for integrating cultural competence, presents case studies demonstrating these principles in action, and summarizes the measurable benefits achieved. A comparative table highlights the distinctions between major frameworks and strategies, culminating in a conclusion that emphasizes actionable steps for advancing equity in health assessments. Understanding and integrating cultural competence in health assessments is essential for addressing health disparities, improving data accuracy, and fostering trust with diverse populations. However, contemporary scholarship and practice demand a shift from checklist-based approaches to more nuanced, justice-oriented frameworks that recognize the complexity of culture, power, and systemic inequities. The evolution from cultural competence to equity-centered frameworks reflects a shift toward more dynamic, inclusive, and justice-oriented approaches. Cultural competence, once focused on acquiring static knowledge about different cultures, has been criticized for promoting essentialism. In contrast, cultural humility emphasizes lifelong learning, self-reflection, and addressing power imbalances. Intersectionality highlights the need to consider overlapping identities, e.g., race, gender, classes, and their impact on health risks and access, while structural competency shifts focus to the systemic factors shaping health outcomes. Culturally responsive and anti-oppressive practices further prioritize equity by adapting care to communities' lived realities and challenging institutional biases. Together, these frameworks emphasize humility, reflexivity, and structural change over static knowledge acquisition. Evidence-based strategies for integrating cultural competence into health assessments rely on established frameworks that provide structured guidance. The class standards emphasize organizational policies, staff training, language access, and ongoing evaluation to ensure culturally and linguistically appropriate services. The Campenha-Bacote model focuses on self-assessment, cultural encounters, and continuous learning, treating cultural competence as an ongoing process. Similarly, the Purnell model offers a holistic, systems-based approach with domains for assessing and addressing cultural needs, making it particularly effective for tailoring interventions to diverse populations. Together, these frameworks provide actionable tools for embedding cultural competence into healthcare practices. Actionable strategies for integrating cultural competence into health assessments include community-based participatory research, CBPR, which fosters equal partnerships with community members throughout the assessment process. Cultural brokers or liaisons, trusted community members, help bridge cultural gaps and improve communication. Culturally adapted tools ensure instruments are tailored to the community's language, literacy, and cultural context, validated through piloting. Interpreter and translation services ensure accessibility by using certified interpreters and translating materials into relevant languages. Lastly, mixed methods data collection, combining quantitative and qualitative approaches, provides richer, more nuanced insights into community needs and perspectives. Institutional-level strategies to enhance cultural competence include diversity hiring, ensuring staff reflect the communities being assessed, and cultural competence training, offering ongoing, interactive, and context-specific education for all staff. Additionally, policy integration embeds cultural competence into organizational policies and practices. Case studies consistently demonstrate the effectiveness of culturally competent approaches in improving health outcomes and fostering trust within diverse populations. Programs like Ohero Con in the Mohawk Nation and Kwungasvik in Alaska highlight the importance of community-led initiatives, traditional knowledge, and intergenerational involvement, resulting in improved resilience, cultural identity, and mental health. Similarly, refugee-focused programs, such as those for Bosnian families and Southeast Asian communities, utilize bicultural facilitators, trauma-informed care, and culturally adapted assessments to reduce stigma, increase participation, and enhance access to care. Other initiatives like SISTA for African American women and the Stanford Chronic Disease Self-Management Program in Australia emphasize culturally tailored tools and peer-led models to promote safer behaviors and better chronic disease management. Across these examples, the use of culturally sensitive tools, community leadership, and adapted interventions consistently leads to higher engagement, improved satisfaction, and better health outcomes, underscoring the critical role of cultural competence in healthcare.